Hi, so welcome to another episode of On the Sofa with Rouge and the Specialist Medical Clinic and the Gibmed Hospital. This is episode 4, and today you're in for a treat. We're going to meet the GPs that are based here at the Gibmed Hospital. I'm sure you want to know all about them, because if you're feeling unwell, then you can always come here and see them. On what better way to find out what they're like is by meeting them. So I have to welcome you all today. We've got Dr. Aaron Dehghan. Dehghan.
Yeah.
We've got Dr. Aga Biel.
Yeah, hello.
And I think you all know Dr. Krish Rawal. He's back for a little bit more because he can't get enough. So it's really great that you're here, because we've been talking to Dr. David Dehghan, we've spoken to Patrick Shaw, we've spoken to Tony, and now it's your turn. We're trying to build a picture of what this establishment really is about, and to meet the people that run it, work here, and the vision. So I want to ask you guys a few questions. I'm going to ask you some relatively general questions, but my main thing is, Aaron, let's start with you. What brings you to Gibraltar? Tell me a little bit about you.
So we're not from Gibraltar. We were living in England, me, my wife, and at that time, our 2-year-old Lily. And really, we were just looking for a bit of a different life for Lily. That was the main thing, to be more outdoors, to be in a different country that was more sunny, to be honest. And we thought about it a lot. We spent a lot of time around Tarifa, Malaga, visited Gibraltar.
Did you know people here, or
didn't know a single soul here? We sold our house. We didn't even sell our house. We left our house. I drove with my dad here. My wife flew here with a 2-year-old, and we started work on the Monday.
Wow.
Yeah, so
incredible.
And the rest is history. We love it.
And how long have you been here?
1.5 years.
Okay.
I've had another child since then.
Oh, so you've got Janita now?
We do. Yeah.
Wow, that's brilliant.
We haven't put him off yet.
No.
I haven't managed it yet.
Yeah, I mean, we were talking before about the quality of life, I suppose. You do have that here, and it's a safe place for children. Would you agree, Aga, that it because you've got children as well?
Only one.
Okay.
Yeah, he's only, 2.5 years, and he was just a little baby, 1-year-old, when we moved here. And yeah, with my husband, Ross, we decided that it's probably the best decision. We lived in a lovely little village in Cotswolds, so it was great there, but we think Gibraltar is very child-friendly. The people are lovely here, it's safe, and I think that's the kind of future we want for our boy.
Okay, and where did you study to become a doctor? I mean, because you're Polish.
Yes, I studied in Poland, so I studied in Silesia. It is a part of the western south of Poland.
Okay.
It's famous for its coal mines. It's a bit far from my home, but at the time, for an 18-year-old, that was great. But yeah,
Get away from your parents, no?
No, not from my parents, just some freedom. Exactly. Yeah, I think that's every 18-year-old's dream.
Yeah.
But yeah, my parents supported me with parcels of food throughout the 6 years at university. Yeah, it's beautiful place. Poland is a little bit different. It's a little bit different system. But from Poland, I moved to the UK, where I finished my GP training there. So kind of when I moved to Gibraltar, now it's the third country which I practiced in. But at least it's very similar to the UK, the standards and the guidance.
Yeah.
So
is that an attraction as a GP, not from Gibraltar? I mean, maybe Krish, you can relate to that, because you're also from
the UK.
From the UK, like Aaron, and you've come to live in Gib.
Yes. So you mean in terms of how we practice?
In terms of the way you practice, yes. and the rule, the legalities, I suppose.
Aaron and I, we trained in the UK, so we're very familiar with them. We are taught a very specific way of practicing medicine and how general practice in particular works. And although that's the way I was taught, I also do feel very strongly that it's probably one of the best ways. The NHS, albeit the NHS at the moment, we know is going through a few little issues, but actually the NHS as a healthcare provider and system is probably one of the best in the world, because it's it really hinges on primary care. That's how it started. The NHS started with primary care being the gateway into any other kind of service. The cornerstone of the NHS was always primary care. Right. Because we are the filters. We see everything and everyone. And GPs, we're not specialists in any particular field, but I think we are specialists in terms of family medicine and specialists in general, kind of everything really, which has its own challenges. Instead of being able to switch from from unwell child to an adult without diabetes to somebody with lung issues to somebody with psychological issues literally in the space of 10 minutes. So to come here and have a lifestyle change where that model of medicine for us is essentially the same is a huge attraction, because it's very much a way I like and believe that medicine, primary care in particular, should be delivered.
Okay. And tell me, what makes a good GP? I mean, what made you want to be a GP? Well, Aaron, let's start with you.
That's a hard question. So I did think a lot about being a GP, actually. I was pursuing an academic career in endocrinology, so hormones. I was doing research. So actually, to turn to GP was a big change in direction. But why I went into medicine was primarily because I loved the science. I did a degree before medicine.
Okay.
And
in what? In science?
In biomedical, anatomical sciences, so basic science, like research science. And I loved the science, but I also loved the relationship, the conversation, the kind of, the clinical side of medicine.
Yeah.
So after kind of years as a junior doctor, it kind of came one day as a bit of a no-brainer that GP did all of that. And actually you got to follow people over, as Chris said, over a lifetime. And part of going back to the first question, why I wanted to make this move was because a lot of that, not totally, but it's becoming more and more difficult in the NHS. You go through sometimes 60, 70 people in a day when you're on call.
Wow.
It's very difficult I know.
Yeah.
And
how do you deliver a good job? How do you do a good job?
That's the difficulty.
When it's like a production line.
Yeah.
And, you strive to do so. But if you know those people, so you've been 20, 30 years as a GP in a community, it's very different to meeting somebody as a junior GP at that point and building those relationships. And one of the things David said, I was the first person that came here as what's called a salary GP. So he came and we'll talk probably, I guess, a bit more about that. But when I talked to David, one of the things he said was, I want people to feel that this is my GP. And this GP knows me, this person knows me. They can take what the specialist said.
Like a family doctor.
Yes.
No?
And, that was an incentive to move here. That's what I wanted when I went into GP, to be able to hold that knowledge and to be there through all those different parts in someone's life. And
continuity of care, that's so important.
Exactly.
Yeah. Absolutely.
Yeah.
I do agree. When I worked in the NHS, I worked part-time because my baby was just little. But I felt like I'm working all the time because I was coming in on my days off. I was working from 8 o'clock till 8 o'clock in the afternoon, evening, actually. So, it was exhausting. And I think long-term, probably impossible to sustain. And I think what made me to become a GP, because when I started, I wanted to be pediatrician, neonatologist. I was just kind of coming with different ideas after every rotation, what I want to do in life. But for me, is the kind of professional curiosity. I'm actually very curious about people. I like talking to them. I like to know them. Sometimes people might feel like, oh, why is she asking me all these questions about my life, about what they do, and about the children, the family, if they mention that. But I think that's important.
You get an overall picture. I mean, the person comes in with, nerves, which are, you think, well, what is the bigger picture?
What's something
I suppose
like it?
that's with every ailment that they might have.
Yeah, absolutely. About the lifestyle, about the diet, what's bugging them. Because very often, as GPs, I think we are kind of on the kind of bottom of the kind of healthcare, where we kind of try to differentiate between like the medical side of things. If people have medical symptoms, but sometimes they have psychosomatic symptoms, sometimes these things are psychological. And for us, it's very important to know these things. Yeah. And as Aaron said, following the whole families from a little baby to an adult, and then, how the families work, how they interact. And that's very interesting. And it's a great job. I think that's the best job in medicine you can have.
You're just GPs. Well, you don't specialise in anything in particular, or have any of you?
I did, and I guess you have it. Well, you have from a complementary side.
Yeah, complementary side. But in terms of general practice, I suppose our primary qualification, accreditation, is in general practice. Yeah. Which is, you could say, I mean, the title there, general. We're not specialists in that, but you have to learn about it.
Yeah.
Yeah, I would always argue that we are general specialists, really, in that sense, because I don't think, there's certainly no other medical professional who can do what we do. except for GPs. They cannot. We just do the whole lot.
Yeah, absolutely. And we can, we are allowed, and if we want, we can have our special interests. So then we can do diplomas or do some courses in the area which interests us. And today I just finished my course in menopause. So I can solve apparently 95% of problems with menopause. So that's good.
Good to know, because I'm going to be doing a podcast on menopause, just on menopause. So I think I might have you back.
Oh, perfect.
If you don't mind.
So we're all within our team, because there's one extra GP who's not here, but within our team, we've all kind of got our areas. And so I did, when I was in the UK, I did an extra diploma in geriatric medicine, did a kind of care for the elderly. And now I'm doing a bit of lifestyle medicine, well, a lot more lifestyle, like longevity medicine. So that's my area. We all do GP.
Okay, but then you can do these diplomas in between that give you a little bit more knowledge on a certain topic.
Yeah.
Exactly.
Because
so
it's very
health, everything.
Yeah.
Everything, complementary as well.
Yeah.
And then our other GP is not here, is in paediatrics.
Yeah.
Okay, interesting. What attracted you to come and work at the Gibmed Hospital, and what is it that the Gibmed Hospital offers you as a GP?
Well, I guess when I came, it was very much a kind of blank sheet. It was we are starting this.
Right.
No, everything was already happening, but we're going to start this primary care service and kind of have salaried GPs, build a team around us. And it was that excitement, really, to be part of that project
new.
And to be given the autonomy and freedom to practice in a way that we want to, and to be able to have the time to do it justice as well. And I think that's been the biggest game changer. You know, when you go from doing sometimes really quite brutal level work, when you go through those days where actually you don't drink, you don't have food, you're going through a lot of people, to actually now get to know people, to be part of the community, to bring new ideas, to explore areas of interest. I'm doing a lot of weight loss management and those sorts of things. I wouldn't have had that ability back in the UK, to be honest. So it was to be part of the journey. And now I guess GibMed has allowed that, and now it's just growing, which is more exciting.
Yeah, I've been very attracted to the fact that we are promoting and kind of upholding the UK standards.
Yes.
And that it's very similar to what I experience on the NHS. And I think that was the most important thing for me, the patient safety, care of the patient, how we approach them, how we talk to them, how our reception is amazing and lovely, and how they approach people. So I think that's, for me, was a big kind of sale point to come and work here.
Yeah, because both of you just work here. You don't work for the GHA.
No.
But you, Krish, also have a practice at the GHA.
Yes. Yeah.
So how do you manage both things?
Well, I dedicate a day a week here, and then obviously the rest of the time is to the GHA. And the two are entirely separate in that sense. The difference here is we have 20 minutes for a patient for a kind of a standard GP consultation, and then longer if we're doing well person checks and things like that. We'll have longer. Yeah. Which in itself is nice, because you can relax a little bit in terms of talking.
The time you spend.
Yeah, the time you spend.
Yeah.
I mean, in the NHS, in the GHA, we are given 10 minutes. Obviously,
Yeah.
a little bit very much, of course, because it's entirely dependent on the person who's sitting in front of you, and you cannot rush somebody, particularly if they're not well. You
Yeah,
cannot.
of course.
And so inevitably the 10 minutes becomes 12 and a half or 15, and that adds on with each one. So sometimes you feel that little bit of pressure when you're running late, but equally, like I says, it's all about whether we are GHA or whether we are GibMed. It's all about professional standards and safety of care. And my experiences in both of those settings, we set very, very high standards for both of those things.
Okay. You've all worked away in different places, and now you've come to Gib. What is the biggest difference about working away and working here? Maybe in Poland. Did you work in Poland as a GP?
I did work in Poland as a GP, yes. I think it's very different because Gibraltar is a very small place. So whenever you walk down the street, and I walk with my son, I'm just always knowing someone. So that's a very big difference. I think the the expectations, for instance, in England or here or in Poland are always different. They're the cultural things which are different. And I think the cultural kind of ways of how people perceive health and how their kind of attitude towards it. So in Poland, nobody goes to the doctor unless there is something kind of really bad. They're just almost dead, and then they will come at your door. And then
It's completely the opposite here.
well, I think a lot of Polish people, we are very resilient.
Hard,
and
not
then
hard.
you want just to, I'll just go to the pharmacy, get myself, we have like this kind of cold and flu medication. And then
just get on with it.
Brilliant.
yeah, that would be this.
Yes.
But it has advantages and disadvantages. And I worked in a big city and I worked in a little villages. So it was it was very different. In the UK, I worked in Swindon, which is really deprived area, which also had different challenges, a lot of safeguarding, a lot of kind of lifestyle issues. And here, I think also because it's a private establishment, we, most of the times, as Aaron said, we had a lot of acute cases, sometimes unexpectedly. But most of the time, people are well, they're curious about their health, they want to take care of themselves, and that's where the lifestyle medicine comes in.
Yeah, and they realize that it is important to try and prevent things from happening. So, so culturally, you're quite happy living here and
couldn't be happier.
working in this
honestly.
environment.
Yeah.
It sounds like, a little bit of a different environment to maybe the public sector.
Yeah, only really on that timing and just a little bit more relaxed. But you know, there are a lot of overlaps in terms of how we keep our professional standards high, clinical governance. You know, just having colleagues to support each other and ask questions and things is a massive thing, because it doesn't matter whether you've been in medicine as a GP for a couple of years or whether you've been in it for 30 years plus. Someone is going to walk through the door with something that you just either cannot remember or you just don't know, and it's good to have an opinion from somebody else. Say, what do you think? What should we do? Always with a thinking of safety first. And
so you work quite closely together here. I mean, you're all like helping each other in a way.
Yeah, absolutely. We were exchanging messages this morning. I just read the guidance. I was like, oh, Aaron, I think this patient, we have to ask him about this because that's a new guidance. Yeah.
That's really good.
Yeah.
What is the most challenging thing are you finding at the moment about being a GP? Do we say it? Do we not say it?
being able to walk down Main Street without not place to work.
Yes, it happens with people who work in government that I know who are like stopped wherever they go to Morrison's, they're stopped, they go anywhere, they're stopped. Does that happen?
You walk down the street with
and they say, oh,
Krish,
doctor,
he's
by the
stopped
way.
every 20 seconds. I mean, it does happen.
Does that bother you though?
No, not at all. I think, well, I mean, there's
limits, no?
There is limits, but there's also sometimes it's because actually, and this is something I guess Aga was saying as well, within our role, we're going to be treating people who are our colleagues, our friends, friends of friends, connections all over. And actually, I think when you're in a consulting room, there's something a bit easier about saying, okay, doctor's hat is on now. Let's have this kind of doctor-patient conversation. Whereas actually, if you're in the middle of Morrison's and you don't really want to be talking about something and breaking confidentiality, it's just, it's more difficult to do justice to or do the role properly. I think that's more, otherwise it's nice that actually there's this community around you and you're part of that community.
Do you feel that you're part of the community?
Yeah, absolutely. And I think actually reversely, I sometimes don't know if the patients want me to acknowledge that I know them. So
that's interesting.
Yeah, I think it's just always like, do I look? Do I not look? Do I look away?
I had somebody come to me who said, I'm not coming back to you ever again. I said, well, you did come back. They said, well, we thought I'd give you one more chance. I said, what did I do wrong? He said, well, you never say hello on the bus. And I said, well, I did on purpose. They said, why? I said, because then you're going to have to explain to the person next to you why you know me. They're like, it's Gibraltar. Just say hello. Okay.
That's funny. That's funny. What is your philosophy, Krish? Tell us, what do you think about being a GP and just generally, how do you live life? What is maybe you have a motto or something?
That's a good question. If you want to ask mottos, my honest motto is treat people as you would like them to treat you. And I think that actually does apply very well to general practice, because we treat everyone. We treat all people, really.
Yeah.
And actually, you know, we are not, I'm not a neurosurgeon. I'm not some very detailed, very skilled, you know, micro endocrinologist. I'm a general doctor, really. So patients come and see me, and they don't walk out with the latest medication or some incredible, you know, surgical procedure. But we are part of people's lives.
Yeah.
And I think the way we interact with people, the way we talk to them, the way we see them in the streets and in Morrison's and Main Street and all of these things is very fundamental to how we do business. And, you know, a lot of the time patients will come, we'll talk. I may not give them anything. I might just recommend that they take an ibuprofen. But
just need reassurance.
Reassurance. They walk out the door feeling better about their own decisions, about what they're doing, what their, you know, their expectations, all of these things. So very much that's how I see being a GP. It's how I like to do medicine. Okay. And I feel very much that I like to feel connected with someone, and for them to walk out the door just feeling a little bit better about the situation that they're in, and knowing that actually I'm there when they need me, whether that's in Main Street or Morrison's or anywhere, but preferably in a more professional environment than the cereal aisle.
Okay. Do you guys feel the same?
Yeah, absolutely. I think sometimes people find it that speaking to the GP is sometimes we don't even prescribe anything. We don't make any decisions, but they like to talk to us and kind of talk about the ideas, about the expectations, what they think. And we sometimes add just this maybe a little bit, well, I would like to say a sensible medical voice there to advise them. Yeah. And it's actually them making the decision. We just kind of guide them a little bit and help them in that way. So that's the role of a GP, really.
Yeah.
What's the most important thing when you see a patient for you?
I think I do just kind of captured there is understanding why the person has chosen to come to you at that point. You know, in medicine we learn, and every medical doctor and medical student will know this acronym of ICE, ideas, concerns, expectations. But that's vital to any consult as a doctor, but really as a GP, what somebody's there for, what are they worried about, and addressing that, really. And I guess coming off what Krish has said, it's honesty a lot of the time as well as a GP. I think it's really important when we say, I don't know, or, you know, this is new to me, but we're going to work through it and we're going to speak to people. And I think if you capture that in almost any consult, really, kind of why they're there, what they're worried about, what their concerns are, what they're hoping for, then I think hopefully we've done the job right.
Okay, what do you do when you have to give somebody bad news, where you've seen some results, and how do you do that empathetically and kindly? What do you have? Do you have like a procedure in place?
Well, you know, all doctors are taught. In fact, all medical professionals are taught that. Whether you're a doctor, whether you're a member of the nursing team or the allied health professionals, we're taught that because inevitably at some point you may come across some news that you need to deliver to somebody. So we're all taught the theory. It's a very different thing to actually do it, and it's very much about gauging the person that you're sitting in front of. You know, I've had lots of conversations with family members who say, please don't tell them because of whatever reason, because the news may very well be so devastating that, you know, and how you deliver that, you might give somebody a piece of bad news which will essentially psychologically make them step back so far that then they essentially give up or they stop taking treatment. So
it's very, very delicate, isn't it, really?
So I think it's very much like I was saying about treat other people as you would like to be treated. But I also think, you know, in my consultations with all my patients, and particularly in that case, I also try and stick to the motto, just be kind. Yeah. So be kind how you look after somebody always. Yeah. And if you're going to deliver news, gauge it as best you can. So what you're doing is giving them the news. You have to. You are obliged to give them the news. But as kind as you can, in a way that relates to how they can understand it without mentally shutting off, so they're not hearing what you're saying. So, and sometimes that might not necessarily be, here's your diagnosis today. It might take a bit of time and a few consultations to kind of deliver that, talk about what's next, the plans, where we're going forward. So it's very individual, I think. I'm sure.
That must be the hardest thing about your job, yeah?
Yeah, absolutely. I think during my GP training, my trainer told me that every consultation is not about like how much we know, what we're gonna do. It's not about us and how we feel in the situation, but about the patient and how they feel.
Yeah.
And we just have to kind of empathically react to that.
And how you make them feel, I suppose.
Exactly. Yes. So if we are kind of putting ourselves a little bit in a corner and just kind of listen to the patient and understand, as Aaron said, what are the concerns and what they actually came with. And if we have to break the bad news, I think just listening and maybe kind of gouging a little bit like what they want to hear.
Yeah.
Because I think, as you said, sometimes it might be too much in one go.
Yeah.
And just kind of telling a little bit and then kind of directing, that's the way forward. But yeah, it is difficult. It is difficult. I guess you said most difficult part.
Yeah, I'm sure. Talk me through when a patient comes to see you here. So say somebody's never seen you before, what do? They just ring up and they book an appointment?
Yeah, I think they either ring or lots of people through the website or Facebook. They take
And they come and see you and they'll explain whatever, and then you can send them off to have tests done. So we spoke to Tony about all the different machines that you have here, which are quite revolutionary really in GIB. And then after that, they would come and see you again with the results, or how does it work?
I think most of us, to be honest, I definitely do this. I would say to somebody, look, if these, I would almost preempt sometimes. And going back to the bad news conversation, often we would do that in advance as well. We may give a hint that, look, we're going to need to see you after this scan. But sometimes people are having a blood test for their thyroid, that they've been on the hormone, the treatment for ages, and we've done a blood test. I'm not going to bring somebody back for that.
Yeah.
I'm going to release it to them and let them know it's all good.
How do you do that? You call them?
So either email or call,
Okay.
it depends. I mean, some days are incredibly busy. If there's something we have to call, we will call.
That's good to know, because that is one of the big differences with the GHA. I think they're reluctant to give you any news on the phone.
Yeah, sometimes with the GHA or with the NHS or the GHA, it's just volume really.
Yes, of course.
We see a lot of people and we get a lot of results. So, and of course, if you give somebody a call, number one, you need to know that they're okay with you calling. Number two, are you going to catch them at a good time? Can they talk?
Yeah.
And usually I try my best, and a lot of my colleagues as well, and the team here try as well, to call our patients, because it's nice to instead of getting a... See, I am always very suspicious of no news is good news. I don't like no news is good news.
I like to know as well.
No news
it's good news.
No
yes.
news can be good news, but it can also be, I forgot.
Yeah.
So I like to call them. We do have a lot of systems in place here in GibMed and also in the GHA to phone people through our nursing and our support team so that everything's fine.
Yeah.
Particularly if it's something routine, you don't necessarily have to have a more detailed conversation. But sometimes it's better pick up the phone or do a face-to-face, just because sometimes it's very easy to explain things face-to-face, which are harder on the phone or harder by email. Because you need this injection on this day and this tablet on this day.
Yeah.
It's much easier just to sit down and say, these are your numbers and this is what we're going to do. So again, very individual to the patient.
And sometimes I'll say to somebody, if I'm asking you to come in, it's not because something bad. It's very hard to explain the nuance of why we're doing X, Y, and Z.
And you prefer to see somebody face to explain whatever
it gives them a chance to ask the questions they want. They know that they're not in Morrison's on the phone or picking up their kids or something. It gives it's better for it's better overall, isn't it, to be honest?
In the ideal world, we'd love to see everybody face to face, whether we're talking about GibMed, whether we're talking about the NHS or the GHA. We'd like to see everybody face to face, but we also have to be very aware that we're sitting here checking results. Patients are leading their lives. That's the point. That's what we're here for, is to marry medicine and looking after them and their healthcare and their well-being with their lives. Yeah. So sometimes it's one thing to say, I'd like to see you again, but it's another thing to be aware that they have a busy job, they have a family, they've got things to do, they don't have the time to come in and sit down and say, how's my cholesterol? Fine, thank you very much. That's a big thing for them. And that applies for all medicine delivery, not just here in GibMed or the GHA or the NHS, but generally. What we would love to do is sometimes we have to also tie that in with the people we're looking after. That's the point.
Yeah. And the people in Gibraltar are very, I mean, what all kind of, mostly they want to know everything. They're very curious. You know? They want everything. How does that affected you as like people from outside coming to live here and mixing in with our
I enjoy it, to be honest.
Yeah.
I always say I prefer somebody to have the information as long as it's bad news, but have the information beforehand.
Yeah.
Let them have all the conversations they want to with family and ChatGPT these days, and Google, and then come and put it out there.
Yeah.
And it makes it interesting for me, because then we're doing it exactly as Krish says. We're putting it in the context of what they know already, what they've looked up, who's going to influence. So, I mean, overall, I think it's a good thing, to be honest. Those conversations they're quite fun most of the time.
Yeah.
I just love it. I just really kind of nicely sync with it. I think we Polish people, and that's why so many of us here, we are just much more straightforward and much more kind of open.
It's much better, isn't it, to be like that, I think.
Yeah, I love it. There's the clarity, and you know what you stand on. There's no backhanded compliments.
Exactly.
Yeah, if somebody's not complimenting you, you know straight away. And I love it.
So I wanted to talk very quickly, because we've already been talking for half an hour, on mental health. So, because I think people would like to know, especially if somebody is suffering with their mental health and feeling a bit anxious, depressed. A lot of people say they go to maybe the GHA and they get, antidepressants straight away. Do you advise them to have some therapy to try that, or how would you approach it? And would you approach it differently because it's the Gibmed Hospital? I mean, what are the differences with being here?
I mean, Krish is probably going to be able to answer this question the best, but I think we are very lucky in the speed we can get a psychologist. And I think,
of course,
I wouldn't say you give antidepressants straight away. It's probably because, and I don't know this for a fact, but I've heard there's quite a long wait sometimes. And that's what it was in the NHS. There was an incredibly long wait for a psychologist.
Yeah.
And sometimes there has to be a mechanism to manage some of those things beforehand and work with that patient. So I don't know if you want to add anything to what I've said.
It's the antidepressant question, and patients just literally coming and getting antidepressants straight away is not entirely true. In fact, it's definitely not.
Okay.
Yes, we have less time in the GHA, for example, or the NHS. In some NHS practices, 7.5 minutes, not even 10. So it's even quicker.
Wow.
We have 20 minutes here. So you could argue we have more time here. We can explore things a little bit. But the decision perhaps to prescribe something or to recommend counselling or to recommend something, even more escalated up to referring to a psychiatrist, for example, based on the person that walks in the door, who's telling you what they're going through and your experience, your assessment of these things. But actually, it comes back to what I was saying earlier about trying to fit what we do into somebody's life. So, for example, a psychologist or counselling, it's evidence proven that it's very, very good for you, and it's a really good way of avoiding medication. But think of it from the perspective of the person that's come to see you. So they're trying to maintain a family and a life and children and schools and everything else and normality. Yeah. And then you're going to say to them, actually, no, I want you to take at least an hour a week out of your week, your working week, not in the evenings, your working week, which is probably going to be 2 hours, because it's going to take them 20 minutes to get there and 20 minutes to come back, to go and sit with a counsellor or a psychologist. So logistically, it's hard work. It's exhausting. Going to counsellors is exhausting, going through all of these and bringing up a lot of emotions and things. Yeah. It's very difficult. And sometimes you have to just, you remember, as Aaron says, these patients, they've talked to their families already. They've talked to their friends. They've Googled things. They've looked things up. They've requested help. They've gone online. They've done surveys. They've done these things. They come to you at the end of that journey already. So sometimes, actually, I will cut to the quick straight away and say, yes, I think you need a medication. Yeah. None of the preamble, but that's because that is the assessment that we have made already. And that's the assessment that my colleagues in the GHA have made already. So when we go to that, it's because that is the right decision to make for all of us as GPs, whether we work in GibMed or the GHA, to make that right decision at that point. But equally, it's a shared decision. So, somebody might come to me and say, I'm struggling. So, look, what would you feel comfortable with? Would you prefer to go and see a counsellor? Would you prefer to take medicine? What's going to make you feel better, or let's try counselling and come back to me.
So it's having the time with the patient to go through everything as well. And the good thing about here is that there is a psychiatrist.
There's psychiatrists and psychologists, as Krish says, and counsellors, but I wouldn't always send to them if actually the right decision is to use medicine. So it's very much that conversation, really.
Yeah, and we use the same guidelines, either if it's in a hospital or here. Like, we're not inventing any different medicine here. I think the outcome might be different, but it's only because we tailor it to the patient.
Okay. Quite quickly, I want to know, how do you guys keep up to date with medication, information, learning?
Well, there's plentiful of the kind of resources for GPs in the UK. We have, well, I wouldn't use any names, but there is online courses, online training, refresher days, acute kind of clinics, kind of refresher days. So there's plenty of it. And as we all, with Aaron, we just read every day. And as Krish said earlier, that you have 20 patients each day, and it's sometimes you have patients who you don't know what to do about, you haven't heard about something, or you're not sure, so you read about it every day, either the research or either the guidance. So yes, I think there's never a day where you wouldn't read anything new.
You're learning the whole time.
Stuff. I mean, a lot of these courses that we go and get subsequent little podcasts and little updates and things that you can just do this kind of opportunistic learning, and also ask my colleagues, because they sometimes know and they've seen. I mean, we're learning every day. The patients are our best teachers, really, in that sense. It's the truth. They come in, they tell us, we understand more because they're telling us not only what they're feeling, but they're telling us how it is to live with whatever this issue is. We might say, I know the biochemistry of diabetes, I know it very, very well, but I don't understand how it is to live with it. But the patients will certainly tell me how, and that's really good teaching.
So a couple more just to finish off. How do you like to chill out? Because being a GP must take an emotional toll on you, and then you have to go home to your families and your life, and sometimes it can leave you a little bit like, how do you chill out? What's the best for all of you? I mean, I think I've ever asked you this before.
Well, I wish it was something like climbing up the med steps every night or something, but truthfully it's not. It's my girls, when I go home, is, it's a breath of fresh air. You go in, they're little, they're 4 years old and 9 months old, so they're full of energy. And then when they go to bed, if they go to bed, then it's just time with my wife, really, just debriefing from the day, listening to music, watching something. I mean, being with friends, it's not particularly a hobby, but it's just having that community around. That's it, really.
That's nice.
Friends.
That's nice. What about you, Aga?
Well, when I come back home, then it's a lot of housework. Yes. There is also my little boy, which I cherish, spending time with him, because he's only little, 2.5. So he's at the stage where he's starting to talk, be a little bit more independent and come up with silly ideas. And I try almost every day to go for at least half an hour to the gym, just listen to some music, cumbia, actually, Spanish kind of speaking, and just relax in that way, just kind of calm my mind.
What about you?
You have to. Sometimes you just try and move your mind away from. It's very easy to take work home and be thinking about it. And I often think this. I've spoken to a lot of colleagues about mine. So, for example, if we worked in the UK, we'd probably consider it normal to maybe commute 20 minutes to work and 20 minutes or half an hour back from work, which is your decompression. We don't have it here. You're home very soon after work, carrying that thought process, energy home. My kids are older, so they're much more self-reliant in that sense. So I try and do things which, I do the normal things in the evenings, but I also, I'm very badly. I'm playing guitar, but I'm learning to play. And actually I quite like the fact that I'm terrible at it, because then it switches. I have to concentrate so hard on it that I forget the day. So I try and do that. I try and, do as much exercise as I can. Do the walking. I just literally started in the last few weeks, which is something which has been a fantastic, because I love my flamenco. which is what I'm trying to learn flamenco guitar. And I've started flamenco dancing
Guitar?
lessons.
Oh, no,
but
dancing
I go to the lessons with my 4-year-old.
Oh,
I tell you what, Lindsay,
she's amazing. Yeah, she is.
I don't even have 2 left feet. I
That's
literally,
so funny.
I cannot
Good
dance
to you.
for toffee. And bless her, she's very tolerant. She's like, Christian, do this, do that, do this. And she can see that I clearly cannot dance.
Great.
But
That's not what I've heard. I've heard it's a profession.
I got roots under the anger management, so I try and take myself away from work like these guys do, and do something which moves my mind away from it, and that really allows you to process it without thinking. That's the end of it.
Okay, one very last thing. What is the best advice that you've ever been given that has kind of stayed with you all the way through?
I think on this one.
Oof, yeah, no, that's
Anything that's really wrong home?
I mean, probably we're all going to have some variant on this, and it captures a lot of our conversation, but I guess you can't pour from an empty cup. And I think that works on an individual basis, but also in what we do as our role as a GP. You've got to look after yourself as a person to actually be good in your job role. So I need to have that time in the evening. I need to have those interests. I need to be with my family to be a good GP. And sometimes my job as a GP is to say to people, you need to take time for yourself to get those, we talked about mental health. Sometimes it's actually, mental health is a holistic thing that you need to know someone's life. So I'd probably say that.
I think professionally, I would say that probably, again, just if you listen to something and if you don't understand, just try to make sure that you do and you kind of get to the bottom of it, because otherwise we just kind of not understanding what's happening with the patient. And kind of privately, I think the most important advice, which my dad gave me, is that you just live once and you are not waiting for something to happen in your life. You're living now and you just have to make most of it. Okay.
Yeah, I think the best advice given to me was by one of my consultants when I was a very, very junior doctor, and I trained at Guy's Hospital in London, and I was on this very kind of straight academic track in medicine, and I decided to completely go left of arc, and I applied for a job with the British Antarctic Survey. So I've done that, and I'm going to go off for a couple of years to Antarctica. It's so completely away from this kind of narrow, very set track in medicine. And the consultant I spoke to, who's helping me with our application, was my referee. He said, it will make you a better doctor. Life experience, because you cannot relate to and experience what other people experience if you have no life experience yourself. And I think the team here are here in Gib. This is not where they were born. None of us were born here. We didn't grow up here. We didn't train here. And so we all come with life experience. And I think that's what makes us good doctors, is having life experience, which then allows us to empathise with the people sitting in front of us and try and put ourselves in their position.
Well, I certainly would feel very safe in all your hands if I came here and saw you.
Good.
And I hope that everybody who's watching this will feel the same and book an appointment with you if they feel they would like that, because you're all very personable and approachable. So thank you so much for your time.
Thank you.
Thank you
for telling us your big secrets. Okay, thank you very much for watching.
Thank you.